Hi, I'm Dr. Cath Watson, and today PD Insurance has asked me to talk to you about how to tell when you need to call the vet about your animal. So the first rule of thumb I'd use is that if their illness or injury seems to be severe enough that if the same thing was affecting you, you'd call the doctor or take yourself off to the hospital, then absolutely you need to call your veterinarian. The first thing you really need to do is make sure you know what their normal is. So when we're talking about things like obvious trauma, they've been hit by a car, fallen off the roof, there's excessive bleeding, or they've come home with a really large wound, I would have thought that's fairly obvious. You need to call the vet, you need to do something about that because their life is potentially in danger with that. Same thing with seizures. Seizures are not necessarily something you need to rush them straight down to a vet for. Most seizures last less than a minute, even though it probably feels like hours at the time. Best thing you can do is observe as much as possible what they're doing, what they've done before the seizures happened, how long it lasts as much as you can, and how quickly they're going to recover. But by all means, pick up the phone after that and call for advice. If the seizuring doesn't stop after a minute or two, then that becomes much more serious and you should definitely be calling your vet as an emergency. If your pet is showing signs of breathing difficulty, so that might be increased effort and you can really see their abdomen starting to work when they're breathing, their chest is moving in and out, particularly in cats if they've got their mouth open and breathing, and dogs that are panting excessively but don't really seem to be getting enough air in and they're not pausing for any other breath, or when they are, it seems to be really laboured. Anything where they're struggling to breathe generally needs fairly urgent assessment. Struggling to breathe is meant to be one of the most distressing situations anyone can be in, that includes humans. So don't muck around if they're really struggling to breathe. Vomiting and diarrhoea is always a difficult one. If the vomiting has lasted for more than 24 to 48 hours, or you're seeing blood with the vomit, or they're clearly potentially losing consciousness or really, really not recovering between bouts of vomiting, then definitely you need to take action quickly. Bloody diarrhoea definitely needs to be seen urgently. But same as us, a wee tummy bug often lasts 24 to 48 hours. There might be a little bit of vomiting to start with over the first hour or two, and then it settles down. And if they seem to be fine after that, it's not getting worse. And then after a day or two, they start getting their appetite back. Probably not something you need to panic about. Obviously, if your pet is collapsed or semi-conscious, that's going to be an emergency too. Things like uncoordinated gait, so that's walking around and maybe the back legs are crossing over or they're staggering sideways, or just not quite managing to do the jumping that they used to, maybe missing the table if they're a cat, maybe for dogs they're struggling to get in the back of the car. Those sort of things, definitely it's worth going to see your vet about. It may be something as simple as a sore back. It may be something much more serious like anemia or disc problems in their back, or potentially some other neurological problems as well. When it comes to eating, we're much more concerned about cats that are not eating than dogs that are not eating, mostly because cats actually can't survive very long without eating, 2 to 3 days, and it starts having pretty serious impact on their gut. Dogs can potentially go longer, but the reality is if your dog hasn't eaten for 2 to 3 days and it's not normally a fussy eater who might spend 24 hours not eating but otherwise behaving normally, not so worried about it. And we do get small breeds of dog in particular who might go 24, 36 hours without particularly being interested in food, and then they'll go and have a graze again and they're pretty happy like that. As long as they've got normal activity, interacting with you normally, seem to be drinking fine, got plenty of energy, not worried about them missing breakfast, even if it's regularly. If your pet is keeping you up at night when they haven't in the past, and that might be getting up to go to the toilet regularly, wandering around the house, making noise, panting, barking, anything that's disturbing your sleep, obviously they're not in a happy place either, definitely needs to be seen. Things like eye changes. So if you've noticed they're squinting or their eyes have changed colours, or and it might be something like a bluish colour, or it might be the inside of the eye has changed colour. You're seeing excessive discharge, particularly if they're rubbing at the eyes or they look really, really red. any of those sort of things, and particularly if the eye's bulging, definitely eyes it's not worth mucking around with, because you only get two and they can't be replaced. The advantage for cats and dogs is they're not quite as reliant on eyesight as we are, but eyes often are really painful too. So that squinting, lots of moisture coming out, particularly in the corners of the eye, staining there, those are all things worth getting checked out. Lumps and bumps. Sometimes when we notice a lump for the first time, it can seem really, really big, particularly little fatty lumps that can be hiding under a layer of muscle and all of a sudden pop out. So if you've got a lump that's appeared suddenly, but it's not bothering the dog, my suggestion is monitor that for maybe a week or two and just see if it is changing. Is it bothering your cat or your dog? Is it growing in size? Is the surface changing? Is anything else changing about it? Anything that's changing quickly, definitely I'd get seen sooner rather than later. If you think maybe it's just you haven't felt it before or it doesn't seem to be that much of an issue, then definitely next time you get your health checked within the next 6 months or so, get it checked then. The other thing too, as I said earlier, is knowing their normal, knowing what their toileting habits are, their drinking habits, what their normal behaviour is. Changes in those things, particularly increases in thirst, increases in going to the toilet, whether that's peeing or pooing, or actually trying to go to the toilet and they can't. All of those sort of things definitely need to be seen. For minor wounds, if you think it is a wound that on yourself you'd be able to treat yourself, maybe with a little bit of iodine or just giving it a clean up and leaving it alone, that's fine to go ahead and do that. If you are in doubt, like I say, use that rule of thumb. If it was affecting you, would you go to the doctor for it? If the answer is yes, please get it seen. If you think, well, actually I could just keep an eye on this for a little bit, by all means do that. Just bear in mind that if their behaviour has changed significantly, that's a good enough reason to give us a call.